Hi there, this is Dr. Valli Parthasarathy from Synergy Behavior Solutions. I'm the veterinary behavior clinician there, and with me today is our trainer and behavior modification chief, Sarah McLeodry, and we're here to talk a little bit today about the importance of understanding your pet's medical, physical condition as it relates to behavioral conditions. So it was a couple of things to think about for this. There is research to show that the dogs and cats, but especially dogs, more research has been done in dogs than cats right now. But we do know that behavior is going to be affected by pain and stress, and pain especially. So there are studies looking at grimace scales, signs of pain, to give us a better understanding of how it is that different animals show pain. There's actually some grimace scales on rats even, and other species too. So there's been getting more and more interest in just understanding how animals react to pain and how they show pain, horses as well. And so, it's really important when we're thinking about behavior as a general field that anything that causes pain is going to be likely to cause a behavioral change. Sometimes it's really evident, a cat might be limping, or a dog might not be eating well or might be vomiting, but sometimes they manifest just as behavioral changes, and sometimes it's not as obvious to see. So Sarah and I kind of wanted to chat a little bit about, we were just chatting about a study that came out about a year or so ago on now noise, phobia, and pain, which is kind of relevant for 4th of July coming up. And then we were thinking about talking about a couple of cases that we've worked on where physical condition was a factor. So the study that came up was it was looking at sound sensitivities in dogs that did and did not have osteoarthritis. So it was kind of the first study looking at that connection. Some of the things that were really interesting, the thing that I found really interesting was that dogs who had osteoarthritis or joint pain, musculoskeletal pain, tended to have fears, noise sensitivities that were more broadly generalized. They would tend to generalize in places outside of where the original fear-provoking stimulus took place. So I just thought it was really interesting to see that there was a correlation with the pain as well as noise sensitivity, but just the fact that the quality and the characteristics of that behavior problem changed when pain was involved.
And I think you and I see that with my own dog, Lindy. She's a 2-year-old Nova Scotia duck-tolling retriever who has a neurological issue in her back end. And we definitely can tell when she gets a little more barky at odd noises, doors opening, things like that. That's pretty widespread when she's not feeling her best. I can tell if I accidentally forgot her daily midday medication, which, it happens even to the best of us. And so I think that's a really important reminder to all of us is if you see an upswing, especially with older dogs, in noise sensitivity, what's going on.
Yeah, with our dog Jazz, he's about 15 now, but a couple of years ago, he started getting up in the middle of the night and getting really upset and agitated about it. And so one of the things that we did so it's really common for older dogs, like Sarah was hinting on, it's really common for older dogs to start getting up and getting restless at night. And sometimes it is behavioral, purely behavioral. There's a condition called cognitive dysfunction that's there in dogs and in cats. But often the first thing we have to rule out is there's something physical going on. And in his case, it turned out that he had some arthritis pain that we already were managing. But at nighttime, the pain seemed to either get worse or he was noticing it more. So we had to add in some additional pain medication. And once we started doing that, he was able to rest throughout the night again.
Excellent.
Yeah, so it's definitely pain and discomfort can play a major change in behavior in those cases.
And recently, one of my other personal dogs, Bueller, who is a 7.5-year-old fluffy, scruffy mutt, he has had an upswing in pretty significant human-directed aggression, and was very much directed towards his favorite person in the house, which is my 14-year-old son. And they're very well bonded and have had a great relationship for Bueller's 7 years with us. And all of a sudden we're having some major problems. So with Dr. Valli's help, we've been trying to figure out what was going on. We did an initial set of x-rays and we thought maybe there was a mass inside somewhere in his abdomen. Then the radiologist said no. The radiologist recommended an ultrasound, and it's like, oh, this is expensive, and he doesn't really love going to the vet, and so we all start thinking about those things as owners. And I'm very, very glad that we did, because on the ultrasound, they noticed that his adrenal glands were much smaller than normal, which was indicative of having atypical Addison's disease. And none of his blood work showed any signs of Addison's disease at all, which is why it's atypical. And we started him on prednisone, which is the treatment for atypical Addison's disease. And lo and behold, I would say our aggression issues have dropped 99%. Every now and then he still gets a little cranky, and we're still working out our dosing regimen for his new issues. But it's amazing to watch just a dramatic decrease once we got figured out what was going on. And it was not an easy find by any means, because his blood work was perfect. So
yeah, and the thing that's interesting with Bueller, if I could share a little bit of his history, is that he's under treatments for some behavioral problems already. So, but this was not one of them. And so, one of the things that when I have a client who comes to me and maybe their pets have been pretty stable for a while, or at least the behavioral conditions that we know have been stable for a while, but then something new suddenly crops up, then that's the time that we start thinking about, okay, we got to start looking for a physical cause about why this is happening. Because if they're stable for a long time, why is something's changed? In some cases, it can be the environment changing. It can be something happening in the social structure. It can be something in the routine. So there can be different other factors as well. But one of the things that we do need to rule out is the medical side of it. There was a German Shepherd dog that I was working with several years ago, who I was called in originally to work with her because she was having fights with the other dog in the house. And we were able to apply treatment. She was able to get to a point where the two dogs were really comfortable with each other. They were playing with each other. Everything was really stable. And then after, I think it was about 2 years later, after we had gotten everything stable, they contacted me and said, we've had this relapse in the aggressive behavior, and we met and talked about what was going on. And one of the things that we talked about was getting her set up for, getting her fully checked out again, making sure that she had her lab work done, checking blood, urine, everything else. And it turned out that she had actually a significant urinary tract infection. Oh. And after when they treated the urinary tract infection, the aggression towards the other dog resolved. So
I know I get cranky when I've had a urinary tract infection, so I can imagine that a dog does too.
Yeah, absolutely. We also know that just in general, there's a link between the gut and the brain. That's something that's been happening. There's a lot of information that's starting to come out on that. It's a really interesting field, how those two things link together. And so we know that the gut can, distress in the gut can cause stress. And we also know that stress can cause distress in the gut. So sometimes we have to treat both of those when we have a patient coming in.
One of the other cases that Dr. Valli and I have worked on together was a case with a dog who did a pit bully type dog who did a pretty significant bite to a person's face, and was very, very out of character for him. He had been pretty friendly with this person previously. The situation was he was on a couch and the person went to come up to and pet him. He came in for his initial consult. And what did you see on that initial consult, Dr. Valli?
He was really stiff and sore on his hind end, and he was favoring his hind leg. And also I think he was having difficulty sitting as well, if I remember correctly. So we sent him to get his hind end evaluated, and lo and behold, he had an ACL. Yes. So basically he had a cruciate ligament tear that had to go and get fixed.
And because he did have this significant bite, we still did work on it from a behavioral perspective. Mm-hmm. And especially knowing that when he was painful, he would aggress. And we knew that during treatment for his ACL repair, that there was going to be some pain involved and strangers interacting with him. So we did muzzle train him, and we did work on desensitization and counter conditioning to people touching him, mm-hmm. and people approaching him when he was resting and that type of thing. But once we got a lot of the pain under control, it was a significant.
Yeah. Yeah, and that's also a really good point that in the vast majority of cases is that even if there is a physical component to a behavioral problem, it's pretty rare that it's going to be just physical. You know, the couple of examples that we've talked about here, these are also pets that had undergone behavior modification and already had been treated, and so their behaviors were already stable. But a lot of times when we have a client come to us and they have some sort of underlying physical issue going on with their pet, oftentimes we're trying to determine and manage both of those things at the same time through either through the medications and the treatments that we're providing or working in conjunction with the primary veterinarian.
And then there's also some other things that aren't necessarily pain related that can be physical manifestations of a behavior. So I know sometimes we have clients come in and I know you refer some clients to a neurologist because maybe their behavior is looking more seizure-like or things like that.
Mm-hmm. Yeah, absolutely. You can have, for example, if you have sometimes repetitive behaviors can have a seizure background. You can have some repetitive behaviors that are related to problems with the eyes. You can have, and I say seizure like these are repetitive behaviors. So you can have some repetitive behaviors that are associated with their eyes. You can have some repetitive behaviors, like especially mouth-related repetitive behaviors that can be related to their GI tract.
Oh, so like fly snapping?
Mm-hmm. Yep, fly snapping is a big one. For cats, if they're licking at themselves, the vast majority of cats that are over grooming themselves, that's not behavioral. So the vast majority of time, it's something else that's going on, dermatologic, gastrointestinal, something like that. So if your cat is over licking, please talk to your vet about it.
And then speaking of cats, what I know a lot of cat behavior cases come to us with litter box issues. I'm sure there's definitely some behavioral components or physical components to the behavioral issue.
Absolutely. I would say for litter box cases, absolutely. First thing you've got to do before you seek any training help is go to your vet, because there are so many physical conditions that can cause cats to not use the litter box, that those have to be ruled out first. We can do as much behavior modification and training as you want, but if there's a physical problem that's causing your cat to not be able to hold their urine or be irritated, like the bowels are irritated or the bladder's irritated, that's something that only your veterinarian can help you with. So that needs to be treated medically first. You got to rule that out first. And then there's a lot of things behaviorally we can do after that.
Yeah. And I know before I was working at Synergy, I had a client where we were doing, kept marking in the house and door bolting. These two pretty significant behaviors that the owners were being very, very good about trying to manage, but having very little success. And they finally did actually seek the assistance of a veterinary behaviorist. And they found out that he had a retained testicle. And what was very interesting about that particular case is that the behaviors were so ingrained at that point by the time that he was neutered. I was very skeptical if they would actually go away. As a trainer, because he had been doing this for so many years at that point. And it was amazing. I think within 4 days, if my memory serves me correctly, he was no longer marking in the house and was able to sleep in their bedroom with them, which he had been relegated to a laundry room. And so sometimes it's amazing from a trainer side of things that there is not some hang up once the physical is dealt with. But it can linger too.
Yeah, absolutely. And sometimes there could be just physical limitations on what a pet can or can't do. So there was a dog that I was working with that it was actually a multi-dog household, and I'd been called in at least in part because one of the dogs had been urinating. The clients were saying one dog was urinating in the house, and so there were 2 other dogs in the house, and the client said, you know what, I don't think that it's these other dogs because they've never had a house training issue. And I said, well, why don't we set up a video and just watch and let's see what happens. And they contacted me back and they said, hey, it turns out that it's actually our 13-year-old dog who's urinating in the house. And when we and she said, I don't know what's going on with this. And then it turned out that the dog was having trouble getting through the dog door because he just physically wasn't capable of doing it anymore. So he was now urinating in the house. But that's also it also kind of underlines the importance of knowing which animal is actually causing the problem, so you're treating the right one.
Yes. That definitely with house training issues in a multi-dog household, I think that is very critical. And
You're a multi-cat household.
Yeah. Yes, yeah. Because it is hard to tell sometimes, especially with urination. It's a little bit different sometimes. If you have different size dogs with defecation, you can kind of tell who's who. But definitely with urination, it can be a little bit different. So, well, to sum up, I think from my perspective as a trainer is when I see a dog come in that looks painful, is having trouble sitting or doesn't want to lay down, things like that, I always make sure to say, please speak to your veterinarian. Let's find out what's going on. Another big warning sign for me, when you have a young dog that you're house training and they've been house trained, everything's been going perfectly, and all of a sudden there's urination. Definitely looking at urinary tract infections, things like that. And I think for trainers, it's always very, very important to look at the whole animal. It's not just a behavior. And the same thing I think can be said from the veterinarian side of things, as you can.
Yeah, absolutely. And when I'm assessing a patient, I'm looking at the behavior, but I'm also looking at all the physical aspects as much as I can to determine if there's something else that we need to keep an eye on, and also looking at what medications are these patients already on, and that also, and I have to make decisions on that for what treatments I prescribe as well. Or what treatments we're going to pursue to make sure that we're supporting what the primary veterinarian is also trying to do.
Excellent. Well, thank you for joining us today for a dose of behavior with Dr. Valli and myself, Sarah McLeodry. This video will be up on our Facebook page. If you have any specific questions related to this concept, either as a trainer or just as a pet owner, please feel free to leave a comment. And
or as a veterinarian as well.
Yes. As a veterinarian, we love the veterinarians that ask those questions, so please do. And if you have, we're having a lot of new classes coming up and webinars, so please feel free to check those out both on Facebook and our website, which is www.synergybehavior.com, which is pretty easy. And I hope you have a great Tuesday. No, it's Wednesday. Oh my God, I cannot keep my days straight. I think I am in good company with everybody that I
think so. None of us know what day it is anymore.
Someone said it's vaguely a weekday.
I think they're probably right. Well, thank you all for joining us.
Have a good day. Bye.
Bye.